and Aidan for this opportunity, and to Larry and MedX. What a powerful platform to present how one traditional academic journal is joining the revolution. The Financial Times called scholarly publishing the business that the internet could not kill. Instead, journals run the risk of becoming irrelevant if they ignore patients as a key constituent of their community. Patients are key readers and implementers of the evidence, the knowledge that we are all collectively generating here and everywhere. And this knowledge is contained within these covers. The Journal of the American College of Radiology, the JACR, focused on improving imaging research, policy, and practice. Patients were a core yet underserved members of our community. How can we as a journal have a conversation with them, know what evidence they need to make high-quality decisions about the care that they need to receive, to hear what barriers they encounter when they need to access the medical literature? So we started a monthly tweet chat, and we initiated a community engagement intervention. We identified patients and advocates through Twitter and other venues. A JACR Journal staff member tweeted chat reminders, links to articles, and other content that patients might find relevant. Then we compared how well we did during those 6 months. Before the intervention, on the left side, you see the total community. We had a few dominant sub-communities with a high level of interconnectedness. On the right side, you see the patients. What's the difference? On the left side, it was dominated by radiologists and providers. On the right side, we had few patients and advocates who participated, mostly in the periphery, with few ties to the larger community. After the intervention, new sub-communities emerged, decreasing the vertical hierarchy and broadening the community. Not only did we attract more patient participation, they came in from the edges to become central hubs in these newly formed sub-communities. The conversations also evolved. The community functioned before the intervention, where patients and providers participated and co-created a shared content and shared meaning around 3 community-defined domains. The value of imaging, what does it mean and to whom? Change management, what does it look like from a system, a practice, or a patient? And patient-centered care, what defines it? After, the conversations focused on shared solutions. What does it mean to us? Morphed into how can we make it happen? We had more patient participation and community engagement. The number of tweets increased by 10%, but more importantly, the number of additional sub-conversations after an initial tweet increased by 50%, and the length of conversations as measured by replies increased by 80%. Patients took on expanded community roles, and this was really critical to involve the patient in the life of the community. So as a journal, what did we learn? We learned that we can build a community that learns from each other, that responds to invitations to join, and participates in jointly creating content and value. All it took was an invitation. Thank you.